A hip replacement is a surgery that allows restoring hip joint motions and relieving the hip joint from pain. During the surgery, damaged joint is replaced with an artificial joint. The candidate for the surgery is the patient who feels pain in the groin area during the walk and notices decreased motions in the hip joint. If the patient limits his everyday activities and uses painkillers to reduce pain in the hip joint area. Over time, when conservative treatment is ineffective, the patient limits walking and takes crutches in his hands. After some time, sedatives become daily drugs to help sleep at night. The most common causes for the surgery are arthrosis, dysplasia of the hip joint, and femur neck fractures in elderly patients. The main purpose of this surgery is to return the patient to his normal life without pain and the elimination of walking, unable to care for themselves without others' help, and return to previous active daily activities.